Clinically, Anavar has been used to treat burn victims for lean mass preservation in AIDS wasting, alcoholic hepatitis, and delayed growth puberty in males. This alone proves that it's pretty impressive when it comes to increasing muscle protein synthesis. To treat these symptoms, some patients are scripted up to 120 milligrams daily, but remember we are talking about burn victims who are literally trying to repair their skin. For athletes, it could be used to repair soft tissue damage, tendon, and ligament tears. But it's best implemented towards the later stages of a prep to increase muscle protein synthesis and reserve training performance, because you will see noticeable increases in your strength. It works via the glucocorticoid receptor to offset cannibalism. Dosing wise, you'll be looking at anywhere between 25 and 50 milligrams daily, and you'll see some go all the way up to 200 milligrams daily, but I don't think that this should be the case. And if you need that much, you should be looking at other pathways such as injectable compounds that aren't going to have such an impact on your lipid profile. Which brings us into the potential side effects. Anavar is a 17 alkylated steroid. In a 12-week HIV study with 20, 40, 80 milligrams per day, 20 milligrams showed no liver elevation, 40 milligrams showed a 30 to 60% increase in liver toxicity, and 80 milligrams showed a 50 to 100% increase. We have seen 20 milligrams be enough to decrease HDL by 30%, and both 20 milligrams and 40 milligram dosages caused a 45% reduction in endogenous testosterone, which is why it shouldn't be used in isolation and only with testosterone as your base, as per all anabolic androgens. You will also be susceptible to all the other potential side effects of exogenous testosterone use, such as ball shrinkage, acne, and increased infertility. Now, going back to dosing, it's worth noting that Anavar has a 2-phase half-life with a rapid peak 1 hour post-ingestion, so I would recommend splitting your dose, with the first one being pre-training with 300 milligrams of caffeine to increase bioavailability, and the second dose later in the day. And to help spare your poor liver, I would recommend taking TUDCA and NAC alongside with Anavar use, and try to limit the duration of use to 6 to 7 weeks in the final stages of prep, and maybe within a 4 to 6 week mini cut during the off season if you're more of an advanced PED user. For a full tutorial on how to set up your PED cycles, check out my school, Peak Physique, and you can watch the full walkthrough there. Is Anavar good for building muscle?